everyone, it's Dr. Rick, and we're doing an unboxing on tirzepatide. This is the equivalent to Ozempic. Ozempic, for patients that don't have insurance coverage, is like $600 to get the pen for 1 month, and it's just impossible to get. Tirzepatide is the next level from semaglutide. Semaglutide is Ozempic. Tirzepatide is Mounjaro by trade name, but you can get it generic from local compounding pharmacies. Not all of them, but some. Now, this was sent to me and has to be refrigerated. If you're one of my patients, then you just have to let me know, and then we'll order it up. It comes to my office. You just come here to pick it up. So this is the packaging. This has to be refrigerated. This has my patient's name, so I can't show it to you, but that is that. The plus is the B12. And whether you want to keep it in here or not, it's not important. So this is the vial. We're going to be using 25 units. This is a tuberculin syringe, but it's a 25 gauge. Tuberculin syringes give units of measure. There's 100 units in here. We have to give 25 once a week for the first week. But we're going to just mark the spot. All I'm using is the pen cap to put a little indent on the skin. Nothing spectacular, because sometimes when I clean out the area, I forget where I put the clean part. So now that there's a indent in the skin, I'm going to use the alcohol swab, clean off the area, and I'll take the alcohol swab and finish up by using it here to the top of the vial. I'll always have this ready in case the shot oozes, and then the Band-Aid ready. Get the Band-Aid and the cotton ready. Now this is clean, so usually you have to take this down to 25 units. See where that meniscus is, 25. And if you can't see, like I can't see, then I'll go to 30 and I'll just push it up to the halfway point, right there. Now you take that, that's air, you put it into the vial. The center of the vial is where the needle goes. I'm in the needle, I'm in the center. And you just turn it upside down. You have to push the air that you have into the vial. Might get some resistance. And then you pull out 25 units. Oh, it's great, it's red, so it's easy to see.
It.
Now, there is air coming in here, so I'm gonna have to pull in extra.
Okay.
And the reason there's air is because there's, if you can see it, not the whole bottle is full of fluids, so I have to lower the needle a little bit. So you have to play around with this because I'm getting air. So if I bring the needle down to right inside the level of fluid, be a little easier. So what I'm doing is I'm pulling in and out, trying to get enough fluid without the air to get to 25 units. So that's more than enough, right?
Okay. Yep.
My needle is still inside the bottle. I'm going to inject the extra. Sometimes if you tap it, all the air will go to the top, and I'm going to inject the extra. I have to end up with the meniscus at the bottom of the plunger right there, right?
Yep.
So I'll take it there. All this stuff that's extra I don't need. That's 25 units, between the 20 and the 30. I'm identifying the spot where I cleaned. Subcutaneous injection, okay, a little pinch. And usually I'll withdraw a little bit just to make sure I'm not in a blood vessel. There's no blood vessels in the sub-Q, so that's fine. And then we push in everything into the subcutaneous space. Plunger goes all the way in. I can't go any further. There's some left over in the needle, and I pull the needle out. Now, I'm pretty good with this, so I'm not touching anything, but if somebody else is using this, they should be using gloves.
Right.
Technically, I should be using gloves too. And that's pretty much it. Okay. Sometimes if you ever get a spot of blood, you can always use peroxide on the clothes to take it off. Yeah. The idea about using shortcuts or hacks to get to your destination, I think it would be helpful. A lot of people now don't like to wait or invest in something that takes too long, whether that's post-COVID or just our society is getting used to having instant delivery. That's fine. I don't think it's a good thing, but in the case where I'm having patients that are middle age or less than middle age or older than 60, try to change lifestyle and or weight or cholesterol or insulin resistance and glucose levels quickly. I think it's important to motivate, and that motivation stays there, especially when you can see change. If you don't see change on the scale or in the waist to hip ratio or the measurements, or even in the fat percent, I have several patients that are getting their DEXA scans before end of the year. It's defeating. And sometimes what we'll do is we'll go to the data. I think data is more sensitive, but if you have a very high deductible, then nobody wants to get the expensive data. But one way or another, we have to empower people to move forward. And in many cases, I try to not look at the long picture. Well, I will be the head coach and I will always be cognizant to what can happen in the long run. But I would always try to break down or chunk down the goals for my patients to something that's tangible, something you can see the end of. I think a season or 3 months is fair enough to consider, let's try to implement change and see what happens by then. Because other things come up, and it's going to be, whether you're a parent, a small business owner, or you're working your way through school, things come up. And sometimes the priority of what Sigil said as far as 150 minutes a week of cardiovascular fitness, 2 times a week as far as hypertrophy training or just strength training every other day, that gets to be, that puts up a lot of accumulated time away from free time that you might have. Now, I don't want to take away from sleep. I don't want to take away from family time, but we have to be moving forward and trying to do something. If we don't, I think that your disease process will only get worse, and then it's going to be even harder to initiate. So I think this is a fair treatment to use to speed up the resolution. And how do we lose weight best? Cutting calories, bottom line, and exercising more. That does have something as far as just measurement. I think calories do give you an assessment. And there's more to a calorie than just the number, but at its base, if you at least know what your basal metabolic rate is, if you want to check one of those out with LiveLean RX, that's fine. If you are not sure, you can't afford that, well, just take it down about 200 to 500 calories per day, and that'll be a caloric deficit. When you're in deficit, then you won't store. In theory, you won't store. That's kind of what the energy formula of getting too much energy in and not burning it up. That's kind of like a calories in, calories out thing, but it does have some credibility, at least in small steps. If you're trying to get to goal, it's easy to know, just bring your calories down. First, learn about what your calories are. I always tell patients to take pictures of their meals, and usually if I can evaluate the meals, I can break down into macros, I can estimate the caloric density or the caloric count, and then I'll make sweeping movements, meaning suggestions on how to change a couple things. Now, when we've done that and we've failed, then it's time to call in the cavalry, the registered dietitians or nutritionists, to help you with plate-to-plate variability. That's something I don't have the bandwidth for that or the time, but I think there are some very good nutritionists that I rely on. In fact, not to self-promote, but I will be having a discussion the second weekend of January in Bartlett, the Bartlett Nature Center. We'll be doing a dusk hike afterward, but from 2 to 3:30, we'll be having a open forum about how to make changes for the new year. It's called Ignite Your Life. I'll be putting invites and tickets on sale on my website, herbal411.squarespace.com. And we have to top out, but get your tickets now if you're one of my patients. There should be a discount code back on Get Healthy. If you're not a patient, you have to pay full price, because we do I have to pay for the place, and then I have to have my other lecturers come out. So I think that using tirzepatide, which is a GLP-1 agonist, can get you a bump up, can speed things up. Everybody knows what Ozempic is, or Wegovy. That's the same family, except this is the newer one. And you can buy this if you're a diabetic, and your insurance will probably pay for it if your doctor jumps through hoops and gets pre-authorization. And you have to prove that you're truly a diabetic with blood testing. Usually it's a hemoglobin A1C. I think they've stopped accepting fasting glucoses greater than 125. They won't take insulins. I don't know why. If I have somebody that's insulin resistant and has a little elevation in glucose, I say that's enough. But insurance wants to wait until you're very deep into your diabetes before they'll give you something that will work. So how does this work? Number one, I wouldn't do this if you have a history of thyroid cancer, because it can trigger a little crop up of cells. And I was watching some YouTuber bodybuilder, and he said he's been taking it along with a whole bunch of other things he takes, and he's been getting ultrasounds of his thyroid, and so far, nothing. And I'm thinking, wait a minute, Once you trigger that and you have an ultrasound that shows cancer, that's it. You have to take the thing out or get chemotherapy. It's not like you just stop the tirzepatide and the cancer goes away. So I think that some of the people that are hacks, and that guy happened to charge like $1,600 for an hour of a consult, I should charge that, but that's highway robbery. So it is a shortcut, and other people are learning about it. And you don't have to be a diabetic. I think you can use it off-label for appetite suppression. So what does it do? It works as a incretin. So an incretin, without going too deep into the woods, it just changes the way your body utilizes glucose and absorbs it. So in a nutshell, it will help you get rid of extra glucose, which you really should be doing low carb. I believe in low carb, or if you don't want to do that, then you just have to put in a ton of fiber if your gut will tolerate it. You have to get more satiating meals. And that usually, just by macronutrient size, is either protein or fat, or if you do fiber and other things as far as dynamics of food absorption, you can throw fiber into your meal and get a glycemic index that's very low, but you have to take a lot of fiber. You have to really go with a nutritionist to do that plate-to-plate thing, because it needs guidance, and to plan out for 3 months, you'll have to get some help, because it gets tiring because you always have to prep stuff. But if you don't do a low carbohydrate or a high fiber diet or either of those things, I mean, this will still decrease your appetite because it slows down the gastric contents, slows down the stomach, slows down the colon, slows down the small intestine. By slowing things down, you theoretically digest better. But one of the side effects is nausea, because it slows it down too much in some people. And that's why these medicines, both tirzepatide or Mounjaro or Ozempic or Wegovy, they have to be tiered up or titered upward. You have to start slow to prevent nausea and vomiting, and then go aggressively high. So this, at least where I get it, 25 units, which is 2.5 milligrams, can be done every week for about 4 weeks, and you double it after that. And there's a step-up approach for getting to goal. But I think that if you want to try this, if you're one of my patients who want to try this, message me on Get Healthy. If you're an old patient, you'll have to get another package and join up with me again. But I think that this does give you a shortcut. In addition to properly eating, planning out your nutrition, sprinkling in some form of exercise, better than you had before. I don't want to hear that you're just walking every day. 10,000 steps is honorable. That's what all humans should be doing. So you really have to do more than that. And I think the older you get, it's not a guarantee, but the more muscle you have, the less you'll be needing anybody else to depend on. So I think by going into your 50s and 60s with more muscle bulk, it would be healthier. If you haven't done that before, then it'll take some time before you do it. I've pushed my patients aggressively, even my 70-year-olds, and in the last year to 2 years, I've seen a couple of them start to turn over more muscle and get stronger with their movements. So this is a positive. It just takes time. So I think this will help to get you to goal. It'll also help decrease your appetite if you can tolerate the nausea and the constipation. And it'll also help you get rid of extra glucose. This works pretty well. If you have a history of cancer of the thyroid, adrenals, you might want to do something different. There's another group of medicines, SGLT2s, which I did a video on Farxiga, which is a pill. There is no substitute. You can get that from your insurance and only from a pharmacy if you get pre-approved and you're a diabetic. But for a lot of my patients that are not diabetics, I think you can take advantage of this one. If you try to get Wegovy or Ozempic, it'll cost you, from what I saw, like $600 to $700 for a month. That's untouchable. This you can probably get, if you're one of my patients, about $200 to $250, I believe. We're testing out the price, and that's just with the startup. I think the startup vial will it'll get you to about a 6-week point, and then if it's combined with a good healthy lifestyle, exercise, proper sleep, which I didn't mention, but that has to be maximized as well, because if you're going to build up muscle, you have to get proper sleep to restore that muscle that you're working out. All this stuff is what we should have been doing when we were younger, but I'm 61 and I kind of started earlier, but kind of let it go, and then I became a small business owner, which totally sucks, but anyway, it's important to lead a balanced life, and I'll be doing a video on my cholesterol, because that's probably the one indicator that says I'm too stressed out. Anyway, subscribe to my channel and you'll see how I talk about optimizing health and staying young, or at least getting to a blue zone age of 100. So thanks for watching up to this point in time. If you have any questions on tirzepatide or how to get it, how to ramp it up, what to do if you can't get it, if you have Ozempic and it's not working, please put it in the comments section. Otherwise, I'll see you at the next video.